I think this is an incredibly important topic that gets so overlooked. This idea of infertility right now, so many people, I think the stats are that in the next 20 years or so, 50% of people who are looking to conceive will have to go through IVF. And we're becoming more and more kind of infertile for unknown reasons to many of conventional medical specialists. But I know that so much of this has to go what's going on inside of us, our inner terrain, our milieu,
Correct.
And the toxicity, how many toxins we're exposed to, and that a biological system simply won't replicate in such a dirty environment in a sense. But tell us a little bit more about your work, how you became involved in this and all the aspects of what you do to help counter that.
Yes, this is one of my favorite things to talk about right now, not because I am a fertility specialist, but because in clinical practice, I am seeing more and more adults with brain fog and neurologic disease. And so as a naturopathic physician, we're trained to always look upstream and to see why is this happening? And it's not that you're years old. People would think when they're 40, they're tired, and that's the explanation. I said, no, that's common, but not normal. So what the upstream cause of this is neuroinflammation. And neuroinflammation, our brain is the most sensitive organ to toxins. We have a lot of mitochondria in our neurons. The mitochondria are exquisitely sensitive to toxic exposure. And so there's something called vertical transmission. So when your grandmother is exposed to something, she passes it in utero to her daughter. And then when that woman gives birth, she passes her total toxic load to the fetus. And we've been able to document this with cord samples of blood with infants at the time of birth. And there have been 287 chemicals identified in one study in all patients measured, which means that those chemicals crossed the placenta while the baby was in utero. Most of them have never been studied, how they interact together. So 287 chemicals, they assume that 185 of those are carcinogenic. So we kind of come into this world, women are always looking at the nursery, the cotton sheets, the cotton food, the organic food, but they fail to look at this very important window of opportunity in the preconception time before you get pregnant to reduce their total toxic load for the better health outcome of that baby. And so a lot of men have been saying to me, what about me? Yes, it's super important because there's a 40% decline in sperm rate. Sperm count has gone down for 40% since 1980. So this is where we're getting some of these statistics about fertility. Fertility specialists are good at getting an egg and a sperm to fertilize, but they're not going to look upstream and say, why are you struggling with this? And, the reality is, even if you can conceive and have a baby, this problem is still there. So it's going to show up for you later down the road with neurologic complications or numerous other things, immune dysfunction.
Yeah, it's really important to note that it's not just a female issue here. This is a male issue.